I graduated in December of 2017. It took me about 6 months to find a job. I ended up working at the Huntsman Cancer Institute. I learned a lot there and really enjoyed it, but it wasn't a critical care job. It was kind of an outpatient job. So I spent about a year there, and then now currently I'm working in the neuro ICU at the University of Utah. And I'm really enjoying it there, and I've learned a lot and work with a lot of good people. So typical day is we arrive at 5:30, do rounds with the neurosurgeons before they go in to do surgery. Um, then go start do exams on patients, make sure that everything is going well, nothing's changed. Kind of start the notes for the day. Um, then at 9, we will do rounds with the intensivists who just manage the patients in the ICU and answer any questions for the nurses, manage any problems, put in any lines that need done or any procedures that need done, and finish out notes for the rest of the day. So it's kind of a little bit of everything. We do a fair amount of procedures, central lines, arterial lines, those kind of things. We do intubations. We do a lot of, answering nursing questions and addressing, pain issues or changes in mental status or infections or, whatever comes up along the way. And then, as honestly, the way it seems to work out is the neurosurgeons want to do surgery and they want somebody to manage the patients once they're done and while they're in the ICU. And that's really what the team of nurse practitioners and PAs does, is we manage the patients once they're out of surgery and while they're in the ICU. We have a 25-bed ICU. It's divided between two of the advanced practice practitioners, so either two nurse practitioners or two PAs. So we usually have between 10 and 12 patients a day. This was exactly what I had in mind, with the exception of I didn't expect it to be neurocritical care. Other than that, it was exactly what I wanted. So I have a lot to learn as far as neuro goes, but other than that, it's exactly where I wanted to be. Well, two reasons. I did the distance program as a bachelor's degree and really had a good experience. The teachers were good, and um, I figured, why not continue with what I already had a good thing. The second reason, I was here in Salt Lake and compared the prices of University of Utah and BYU and Westminster, and they were a good 50,000 cheaper. So between the two, I was like, I had a good experience last time, and it's much, much cheaper. So
I was very pleased with how I was prepared and very pleased at how well I was able to pick things up and move forward. And my orientation was shorter than average. And when I started, it was a new program. There was a lot of brand new nurse practitioners and PAs. And it was really easy to gauge as to how well you were prepared, especially when you were compared to the people that were trained at other schools and how quickly you were able to succeed compared to them. And I feel like I did as well or better than most. So I feel like I was very well prepared and did well. My advice for them is to absorb as much as you can. There's a lot of information you're going to need and you're going to use on a daily basis. Don't memorize it and then discard it as you test. Really try to retain as much as you can. The other piece of advice is you're under a lot of stress at the moment, and it's easy to be frustrated. It's easy to be emotional. It's easy to, try to be aware of that and try to be patient with those around you, the school, your family members, those kind of things. It's a stressful program. There's a lot of demands. Just, realize that everybody's has your best interest in mind, is trying to prepare you for what you are going to need when you get out there. I guess the other last piece of advice I would give anybody is I've found that the world of healthcare is an incredibly small world. Treat everybody with respect, and don't burn any bridges, because in the 3 years that I've been down here, um, there's been people that I've run into on a casual basis that have helped me get my new job in the neurocritical care. And because I was polite with them and courteous with them, they were like, "Oh yeah, I remember him." And so, it's a small, tight knit world, and people talk, and people interact on a regular basis. I just was very pleased with the program and very pleased with where I ended up and how things have turned out. No problem. Bye bye.